overdose deaths are down a little over 18% from 2022 in Montgomery County, though public health says it's still a major concern.
Unintentional overdoses have been identified as a leading cause of death in Ohio since 2007, according to the Department of Health. And Ohio experienced the most overdose deaths in 2020. Fentanyl was involved in 81% of deaths that year. Officials say it had been combined with other drugs like heroin and cocaine. The Ohio Department of Health reports a higher rate of death among black men than any other demographic in the state.
But one drug is making an impact. The state says that Narcan has decreased the amount of overdose deaths over the years, and the life-saving drug just became available over the counter. You can find it on shelves at Walgreens, CVS, Rite Aid, Kroger, and Walmart. One box comes with 2 doses of the nasal spray and costs about $45. And CareSource is making sure that people know how to use that drug. 2 News reporter Seth Bird was at tonight's training class, and he joins us live in the studio. Seth?
The opioid crisis has touched many lives in our area, which is why Miami Valley Harm Reduction Ohio is making sure people know how to use this.
It makes me feel sad because every overdose is a preventable death.
Montgomery County had over 600 overdose deaths in the last 2 years combined, which is the motivation for Tanya Catron, the founder of Miami Valley Harm Reduction Ohio, to be on the courthouse square once a month, helping the community receive the resources they need and to prevent another lost life.
Providing naloxone, fentanyl test strips, xylazine test strips, anything that we can do to save people's lives.
In addition to the supplies, CareSource was on hand to show everyone how to properly administer the Narcan nasal spray. The first step is to see if a person is responsive and call 911. Then, if they are unresponsive, roll them onto their back.
To tilt their head slightly upwards by the chin, as close as you can with your finger touching the tip of the person's nostril, and then you always want to aim the top toward the person's ear. So it would look like this when you're administering it.
After the Narcan has been given, be aware of the person potentially being agitated and showing signs of withdrawal. Also, putting them in a safe position so they can't harm themselves is also vital.
So you want to roll them on their side, put their arm under their head, and then put their knees up to support them so that they don't roll over flat on the ground with their face down.
Catron feels resources and preventive supplies is the only way this crisis will turn around.
The only way that we can fix this is with a safe supply and with overdose prevention sites. And that's that. We've tried it every other way.
There's also a number up on the screen now that you can call that will alert you when there's a spike in overdoses or dangerous drugs found in the area. In studio, Seth Bird, 2 News.